After 75 years of serving Britain, the NHS is battling a critical crisis. The fundamental promise it was built upon is now at risk. Chronic underfunding is at the heart of this crisis. Budgets fall short, struggling with soaring costs and demand. Inflation, an aging population, and a chronic lack of capital investment, all major factors compounding this dire situation. Critical staff shortages plague nearly every medical profession. The NHS is stretched thin, facing unsustainable vacancy rates. In September 2022, 133,000 vacancies were reported. This isn't just a number. It means immense pressure and burnout. Low pay, crushing workloads, and poor working conditions. These critical factors drive experienced staff from the NHS. This brain drain has severe long-term effects. Fewer experienced professionals mean less mentorship and training for future generations. Patients ultimately bear the brunt. They face unprecedented, agonizing waiting times for vital treatments and appointments. This waiting list backlog is truly immense. Over 7.6 million people are currently on waiting lists across the UK. Mental health services see profoundly concerning delays. Patients needing vital support often wait over 18 months for initial appointments. Emergency departments are overwhelmed. Over 46,000 patients faced waits exceeding 12 hours for admission. This tragic corridor care compromises patient dignity and safety, a stark sign of systemic pressure. Social care cuts exacerbate problems. Medically fit patients are stuck in hospitals, lacking crucial home or community support for discharge. This creates a critical bottleneck. Valuable hospital beds are occupied by patients who could be cared for more appropriately elsewhere. UK healthcare spending often lags significantly behind other G7 nations. This disparity places us at a clear disadvantage. For instance, Germany spent 55% more per capita on healthcare than the UK in 2022. This highlights the disparity. Capital investment has been historically low, facilities crumble, and tools are outdated. A particularly damaging decision: £4.3 billion diverted from crucial capital budgets, impacting long-term capacity. This underinvestment leaves facilities outdated, hindering modern technology adoption for better care. The NHS Long-Term Plan, launched in 2019, was an ambitious blueprint to transform healthcare. Goals included reducing stillbirths, improving mental health, and preventing major diseases to lessen future burden. Then, the COVID-19 pandemic struck, massively disrupting services and straining an already fragile system. Focus shifted entirely to urgent care, responding to the virus. This, however, created an enormous, unprecedented backlog. Post-pandemic, demand surged back, but NHS capacity hadn't recovered. We are witnessing the devastating consequences. To fundamentally address this crisis, a crucial solution is a significant, sustained increase in funding. Experts suggest public spending on health and social care should reach 11 to 12% of GDP by 2025. This would allow better pay, more training places, and crucial investment in infrastructure, boosting NHS resilience. A robust national workforce strategy is vital to recruit, train, and retain healthcare professionals effectively. This means increasing medical school places, offering incentives for GPs, and streamlining recruitment processes. Addressing factors driving staff away: burnout, lack of flexible working, and insufficient support is paramount for retention. Integrated care systems, ICS, are promising, aiming to better coordinate health and social care across the UK. This ensures smoother transitions for patients. It reduces the number of people stuck in hospital beds, awaiting discharge. Digital transformation holds immense potential, from AI diagnostics to virtual consultations and remote monitoring. Telehealth and remote care can reduce hospital visits and improve accessibility, especially for chronic conditions. Prevention is always better than cure. Greater investment in public health initiatives can dramatically reduce demand on the NHS. Programs targeting smoking cessation, alcohol abuse, and obesity can significantly improve population health and long-term outcomes. Empowering patients with self-management tools and information can significantly lighten the load on our NHS services. Giving patients more control over their own health journey fosters better outcomes and more efficient resource allocation. While the NHS is tax-funded, exploring alternative funding models or supplements is a complex, ongoing debate. Countries like Switzerland combine universal coverage with mandatory health insurance, offering patients extensive choice. However, such systems often come with higher out-of-pocket costs for individuals, impacting accessibility. any shift in funding models requires careful consideration of equity and universal access for everyone. The core principles of the NHS free at the point of use are deeply ingrained in British identity. Protecting these principles while ensuring sustainability is the central, delicate challenge facing the NHS. It demands courageous political leadership and long-term, unwavering cross-party commitment to its future. The NHS isn't just a service, it's a social contract, a symbol of collective responsibility and shared values. Its future depends on our willingness to invest, adapt, and innovate across all levels of care. From primary care to preventative strategies, every aspect needs reevaluation and reinforcement for a stronger NHS. We need to foster a culture of continuous improvement and learning throughout the entire NHS. This includes empowering frontline staff to drive innovation and share best practices across all departments. Reducing bureaucratic hurdles and fostering a supportive environment can unlock huge potential within the NHS. Strengthening primary care networks and general practice is crucial, as they are the very front door of the NHS. The ongoing GP crisis, with fewer doctors and increased demand, threatens this vital front door. Improving continuity of care, with patients seeing the same doctor, builds trust and improves health outcomes. Despite potential, adopting new technology faces barriers: funding, staff training, and complex data sharing. Improving data sharing across different NHS systems is vital for efficient, coordinated care and better patient safety. Cybersecurity remains a significant challenge. Protecting sensitive patient data is paramount against evolving threats. Greater, dedicated funding for mental health services is desperately needed to tackle immense waiting lists and improve support. Emphasizing early intervention for mental health conditions can prevent escalation and significantly improve patient outcomes. Reducing the stigma associated with mental health is vital. It encourages people to seek help sooner. The relentless pressure leads to widespread staff burnout and mental health challenges, impacting care quality. Staff well-being directly impacts patient care. An exhausted workforce struggles to maintain optimal standards. Despite these immense pressures, NHS staff show incredible resilience and unwavering dedication every single day. Public support for the NHS remains immense. It's a cherished institution, a source of national pride. Securing the NHS's future requires collective action. We must all play our part to restore its strength. This means embracing responsibility, supporting reforms, and understanding the complexities involved. Crucially, the patient voice must be central. Their experiences and insights are invaluable for shaping improvements. Further investing in technology and research will future-proof the NHS, enabling faster diagnostics and better treatments. The NHS must also adapt to new challenges, like climate change, impacting public health and service delivery. Furthermore, preparing for potential new diseases and future pandemics is essential for national resilience. Addressing the ever-growing demand on services requires proactive strategies, not just reactive measures. Despite its challenges, the NHS's inherent resilience and capacity for recovery remain a testament to its foundations. A renewed vision, built on public support and political will, can secure its future for generations. Support our NHS, engage with local services, understand the challenges, and advocate for sustainable solutions. By acting together, we can secure a future where the NHS continues to deliver world-class, compassionate healthcare for all.